Okay. Hi, I'm Joni with Looking at Careers with Joni, and I'm here today with John, who's reinvented himself several times in his life. So we're going to do a little chat, and John's going to tell about how he's reinvented himself in many careers. And after that, if you like the video, I hope that you check on like below and subscribe to this channel. So John, how are you doing today?
I'm just doing great today.
Great. Why don't you talk to us a little bit about when you started college and what you decided you wanted to do in your life?
Well, I did have a cousin who was an executive at United Airlines,
Uh-huh.
and after seeing how much flying and traveling he and his wife did, I kind of got the travel bug and chose I should pursue a career in the airline industry as well.
Mhm.
So I did go to college and got a travel management degree, which kind
Mhm.
of puts me in the arena of something like an airline industry employee.
Right.
And although it still took me a year or two, I sold shoes, men's shoes, never women's shoes, men's shoes for 2 years, and then finally got a call and was able to get into United, and I started in their reservations, which was a good base.
Oh,
If
nice.
you're gonna work in the airline industry, you need at that time you needed to be in reservations and stuff
Uh-huh.
like that. This is back in the early 80s.
Okay.
July, yeah, 7/27/81 was my seniority date. So I'll
Oh,
grant you
okay.
things have changed, significantly in 40 years, as they should.
Sure. Yeah.
And so I worked for United for the better part of 20 years, 21, 22 years.
Uh-huh.
And then eventually they phased out the job that I was currently in. I worked in a city ticket office. We had maybe 9 of them around town here in Denver,
Mhm.
and they chose to eliminate all those. So uh, I was 40, 48, 47 at the time,
Mhm.
and still couldn't retire and all that. And fortunately,
Right.
I had met my wife while I was still gainfully employed with United.
Uh-huh.
And that's just the luckiest break right there.
Right.
And so I was able, I needed to go back to school. And
Uh-huh.
so I went to a trade school and got a degree in respiratory therapy uh, back in the day. Go ahead.
Why did you decide on that?
That's funny you should ask. That's where I was just going to go. And
Okay.
because that's when we still had newspapers.
Yeah.
And this is like 2003, 2004. And you couldn't help but open the want ads
Mhm.
and see nothing but healthcare workers were needed at the time.
Sure.
And both my mom and dad had smoked like Pittsburgh steel mills, and so they were
Right.
frequently hospitalized with pneumonia and stuff like
Oh,
that.
wow. Mhm.
And they would have respiratory therapists come in their room and administer whatever type of breathing treatment they would need.
Right.
And so that kind of got my interest. And so I worked, did the school thing, and school was hard. I was the oldest one in our class, and which is rather daunting, and and it did take extra work for me. Uh,
Okay.
I had to go to the library at night. I got to know all the librarians, so that was kind of fun.
Uh-huh.
And then once I graduated from that trade school, I was able to get a job at it's now UC Health. It was the University of Colorado Hospital
Okay.
then, and I worked there as a respiratory therapist for 14, 15 years, something like that.
Right.
And uh, and that was a good fit for me.
Mhm.
It's fun providing therapeutic healthcare where you
Right.
actually see a difference, as opposed to maybe some diagnostic jobs with healthcare where you're just you're helping the physicians interpret whatever data you're giving them so they can diagnose properly.
Yeah.
And but I was more therapeutic. I mean, I would give them medicine, or they would be on a ventilator,
Oh, wow.
and I would try and perhaps I'd be administering their medicine, or on a ventilator, trying to synchronize their breathing with the ventilator, just to make them as comfortable as you can possibly be with a tube shoved down your throat, you know. And,
Right.
so that was, and that was a good career. It can be done. I'm fortunate. I was able to reinvent myself,
Uh-huh.
and I'm lucky in that regard.
What kind of skills do you think you need for a job like that? I,
Uh,
you
well,
know, and before you even answer, I know that there are technical skills that you need to go to school and learn, but what are the non-technical skills that are really helpful in a job like that?
I'd have to say uh, probably people skills, just
Okay.
dealing with people,
Hmm.
empathizing with people, uh,
Okay.
listening to people. That's a big thing. Let them talk. If they're cranky or if they're upset, you just have to let them go. I
Yeah.
mean, and I don't want to say be acquiescent, but you want to listen to them and
Sure.
acknowledge their concern.
Okay.
And and after working for an airline, you develop those customer service skills. Trust me on that. You
That's
surely do.
true. Yeah. And do they teach you that kind of stuff in school too?
They really didn't too much. Grant you, it was addressed that
Yeah.
you have to be nice to people. Well, that kind of makes sense. And
Don't
uh,
slap them around in those
that's right.
hospital beds.
That's
Yeah.
right. And if you want them to be compliant with whatever their treatment regimen is, that's it helps to communicate effectively with them and get them to
Sure.
buy into whatever you're trying to do.
Right. Right. Interesting. And what are the technical kinds of skills that they teach you?
Well, in the school, having no really minimal knowledge of physiology, the human body, and
Oh.
had to learn. They start you out with bones, and these are your bones,
Oh,
and
wow.
then and then various muscles, tissues, various types of tissues that we have in our bodies, organs, uh,
Okay.
and then pharmacology, which was by far and away the most difficult. Pharmacology is all pharmacists are smart. Okay,
Oh, okay.
if you're ever talking to a pharmacist, he or she, they are smart people because it's
Okay.
very challenging, and that was I think that probably was the most difficult subject I think I had.
And so you had to kind of acquire all of those skills too. You know all about medicine now and how it
Just
works.
at that time, yes, that's just enough to focusing primarily on respiratory medicine and stuff like that.
Hmm.
But along with that comes various procedures that I might be involved with, bronchoscopies,
Okay.
where they'll do a little tiny camera, and take a look at your lungs and stuff. I would assist physicians in that regard as well,
Oh, okay.
and and mechanical ventilation uh, is that can be challenging. Various gas laws that you have to know,
Oh,
uh, versus high pressure, low pressure, and volumes, et cetera. Some basic stuff that
sure.
also was very challenging at the time. You had to know your gas laws.
Oh, interesting. So you learn about medical, legal, everything.
Yeah, and
Pharmaceutical.
legal. Actually, I went to a conference, and it was closing by a respiratory therapist who was also an attorney,
Mm.
and
Oh, wow.
so he would tell us, how not to get sued. As
Good to know.
budding future respiratory therapists, he would always say, "You always have to tell the truth. Always, always." He says, I can't defend you if you lie.
Right.
If you make a mistake, I can defend a mistake, and then let the
Yeah.
cards fall where they may be. But
Yeah.
I took that to heart, and just
Good advice for life, huh?
absolutely it is. Absolutely it is.
Yeah.
Sure it is.
And so when you decided to go for that training, how long is that training?
It was an 18-month course,
Okay.
and
Not too bad.
no, 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 and that's what it needed to be. I needed, at the time, again, 46, 47, 48, I couldn't retire, and I needed something in a timely manner
Mhm.
to start another career, and it was a good fit for me.
Okay.
And so it felt good, and it feels good providing help to sick people. It's a
Yeah.
cool thing.
Yeah. That's nice. I think it would be interesting to work in a hospital like that
Oh,
or even
absolutely.
outside. Yeah.
Yep.
So, and I know you recently retired, and you're still reinventing yourself. What kinds of things are you doing now?
Well, I'm currently volunteering a lot and reading significantly more. I mean, I
Oh,
never was an avid reader,
uh-huh.
and that even might be generous. I mean, maybe a book, okay, maybe a book every 6 months, maybe 2 books a year, and
Right.
I'm blowing that up now.
Yeah.
I'm a reading fiend now, and then besides that, I'm volunteering. I've always done Meals on Wheels.
Hmm.
They were good to my mom and dad, and so I kind of wanted to give back
Nice.
in that capacity. And then on Wednesdays, I'm a docent at the Denver Museum for Nature and Science.
Uh-huh.
And then Thursdays and Friday afternoons, I work in a food bank.
Nice. So I have a question about all three of those volunteer jobs. I know that there are lots of people that volunteer to work in all of those different kinds of companies, but do they have people that they hire? Did they ever look for people that get paid to work in those areas?
Oh, absolutely. Yes, there's staff. There is paid staff.
What
And
kind of things should the staff do?
uh, regarding the Meals on Wheels, that's more of
Okay.
the kitchen oriented type stuff, and delivery drivers uh,
Oh,
that would be doing that
okay.
with Meals on Wheels. With
Okay. And I suppose they probably have accounting kinds of people that,
oh yes, oh
okay.
yes, and
So it's
and and
run
with
like
the
a business.
oh yes, it is most definitely.
Yeah.
And with the food bank, again, there's several administrative people who check people's IDs and determine some of their wants and needs. Uh, and they do clothing at this food bank.
Oh,
They
wow.
do education. It's a pretty extensive type thing. They provide
Mhm.
mailboxes for people who don't have an address, and so
Oh, interesting.
so,
Okay.
so they can get any correspondence at this particular location as well.
Oh, interesting. And then at the museum too, they have paid staff,
Oh,
I'm
absolutely. Oh,
sure.
yeah, absolutely. They have volunteer coordinators who kind of lead us around and do an orientation like
Mhm.
that. And but then pretty much after that, we're on our own
Okay.
doing whatever exhibit we happen to be working at the time.
Uh-huh. And I'm only asking that because, a lot of people want to work in areas that give back, but they're also in a position where they're still at an age where they have to get paid. They're not ready to just retire and volunteer their time. And even in industries like that, there are jobs that people could go and apply for and look at and still give back to the community.
Oh, I can guarantee you. I can guarantee you. And especially, I mean, if they're always looking for accountants or bean counters, if
Yeah.
and they need someone to monitor their costs and just, for practical purposes. Yeah, that makes
Sure.
sense to me.
And advertising, I would guess.
Yep, absolutely that. Yep,
Yeah,
yep.
I never even thought about it before, but there's lots of places to go and get jobs that I've never even thought about. So that's
Oh,
great.
I mean, the volunteers, Meals on Wheels falls underneath the VOA, the Volunteers of America. And there, I mean, Meals on Wheels is just one component. They do all types of various things with the VOA as well. And I know they do have paid staff in that regard as well.
Awesome. Awesome. Well, John, I thank you for your time today. And again, this is Joni with with Looking at Careers with Joni. And again, if you like this video, please press like below, and hope that you're here on our next video. And I will be back again soon. Thanks.
Thank you for your time. I appreciate it.
Thank you, John. Bye-bye.
You bet. Bye now.